You're sitting at the kitchen table on a Sunday morning. Coffee's hot, the paper's open, or maybe it's your phone, let's be honest. And your left hand does something strange. It doesn't drop the mug. It doesn't go numb exactly. It just feels different, like it belongs to someone else for about 4 seconds, maybe 5, and then it's back. You flex your fingers. Fine. You pick up the mug again. Fine. You take a sip. Fine. So you do what most people do. You forget about it. By Tuesday, you can't remember which hand it was. By Friday, it never happened. And 6 weeks later, you're in the back of an ambulance with half your face not working, and a paramedic is asking you to smile, and you can't. Not fully. Not on the left side. That Sunday morning, that weird 4 seconds with the coffee mug, that was your brain sending you a telegram. Capital letters, underlined. And you threw it in the bin because it didn't look dramatic enough. Here's what I've learned after 17 years of general practice. Strokes do not start the way you think they start. They don't start with someone clutching their head and collapsing at dinner. That happens. But that's the final act, the curtain call. What most people miss, what I'd estimate about 70 to 80% of my patients over 50 completely miss, are the opening scenes, the quiet ones. The ones that last a few seconds and feel like nothing. And I need to be straight with you about something before we go any further. What I'm going to walk you through in this video is not theory. This is pattern recognition from real clinical work, but it is not a substitute for being examined. If anything I described today sounds like something you've experienced, even once, even briefly, you need to see your doctor. Not next month, this week. I say that not to scare you, but because the window between a warning and a full stroke can be days, sometimes hours. And that window is the single most valuable thing in stroke medicine. We're going to talk about how to recognize it, what to do inside it, and why most people sleepwalk right through it. Before I get into the science, do me a quick favor. Hit subscribe and tap like right now. We're building toward 300,000 subscribers on this channel, and the only reason it grows is because people like you click that button and send these videos to the people they care about. The algorithm doesn't promote prevention, it promotes drama, so we have to do this ourselves. Now, let's talk about what's actually happening inside your head when these warning signs show up. Because once you understand the plumbing, everything else clicks into place. Your brain weighs about 3 pounds. 3. It's roughly 2% of your total body weight. But, and this is the number that changes everything, it consumes about 20% of your entire blood supply. 20%. 1/5 of everything your heart pumps goes straight upstairs to keep the lights on. Think of it this way. Imagine your house has 50 rooms, but one room, just one, uses 20% of all the electricity. That room is your brain. It is the most energy-hungry organ in your body, and it has zero storage. None. Your muscles store glycogen. Your liver stores glucose. Your brain stores nothing. It runs on a live feed. The moment that feed stutters, even for seconds, things start going wrong. Now, what causes that feed to stutter? Let's talk about what's actually happening in the blood vessels. You've got 2 main pipelines running up the sides of your neck. These are your carotid arteries. You can feel them right now if you put 2 fingers just below your jawline. Go ahead, I'll wait. Feel that pulse? That's the main line to your brain. Each one of those carotid arteries is about the width of your pinky finger when you're young and healthy. But here's the thing. Over decades, and I mean starting as early as your 30s, a process called atherosclerosis begins building up inside those walls. Atherosclerosis. It's basically cholesterol, calcium, and inflammatory debris forming a layer of plaque on the inside of the artery wall. Think of it like limescale inside an old kettle. You don't see it from the outside. The kettle still works. But inside, the opening is getting narrower, millimeter by millimeter, year by year. By the time you're 55 or 60, some people have lost 30 to 40% of the diameter in one or both carotid arteries. And they feel completely fine. No pain, no symptoms, nothing. Because the brain is remarkably good at compensating. Up to a point. The problem isn't even the narrowing itself. The real danger is what happens when a piece of that plaque breaks off. Picture this. You've got limescale building up inside a pipe for 20 years. One day, a chunk cracks loose. It doesn't dissolve. It travels downstream, and it gets stuck somewhere narrower. In brain terms, that chunk is called an embolus, a tiny traveling clot or debris fragment. And when it lodges in a smaller vessel inside your brain, it blocks blood flow to whatever region that vessel was feeding. The cells downstream don't get oxygen. They don't get glucose. And within minutes, not hours, minutes, they start dying. That's a stroke. But here's what most people don't know. And this is the part that could genuinely save your life or the life of someone you love. Before the big one, the catastrophic one, many people experience what we call a TIA, transient ischemic attack. I want you to forget that term immediately and remember what I'm about to call it instead, a mini rehearsal. Your brain runs a rehearsal of a stroke. A tiny piece of debris blocks a small vessel, starves a small patch of brain tissue, and then, within minutes, the clot dissolves on its own or gets pushed through. Blood flow returns, the symptoms vanish, and the person thinks, that was weird. Anyway, that TIA, that rehearsal, is the single most important medical event most people over 50 will ever ignore. Studies published in The Lancet show that roughly 15% of all major strokes are preceded by a TIA in the days or weeks before. 15% that we know about. The real number is almost certainly higher, because most TIAs are never reported. People don't go to the emergency room for 4 seconds of hand tingling. They don't call their doctor because their vision went blurry for a minute and then came back. They rationalize it. I slept on my arm. I need new glasses. I was just tired. And here is the good news, because there is genuinely good news here, and it's significant. If a TIA is caught and treated, and by treated, I mean blood thinners, blood pressure management, sometimes a simple procedure to clean out the carotid, the risk of a subsequent major stroke drops by up to 80%. 80. That's not a marginal improvement. That's the difference between walking your grandkid to school next year and learning to use your left hand because your right one doesn't work anymore. The window is everything. And the window is made of symptoms that most people dismiss. So let's go through them. Not the obvious ones, not the face drooping, arm weakness, speech slurring that you see on the posters in the waiting room. You already know those. I want to talk about the ones you don't know, the subtle ones. The ones that don't make it onto posters because they're too quiet, too brief, too easy to explain away. Symptom number 1, sudden unexplained clumsiness in one hand. Not weakness, not numbness, clumsiness. You're buttoning your shirt and your fingers just won't cooperate. You're typing and you keep hitting the wrong keys, but only with one hand. You reach for a glass and misjudge the distance by half an inch. It lasts 30 seconds, maybe a minute, then it's fine. This happens because the motor cortex, the strip of brain tissue that controls fine movement, is one of the most blood-hungry regions in your entire head. When a tiny embolus temporarily blocks flow to that area, you don't lose strength, you lose coordination. And because it comes back so fast, you blame it on tiredness or age or just one of those things. It is not one of those things. Symptom number 2. A sudden, strange visual disturbance in one eye. And I don't mean blurriness, I mean something more specific. You're reading, and suddenly the bottom half of your visual field in one eye goes dark. Or you see a gray curtain dropping down from the top. Or you notice a shimmering, almost sparkling edge to your vision, but only on one side. This is called amaurosis fugax, and it happens when a tiny clot temporarily blocks the ophthalmic artery, which branches directly off the carotid. It's literally a TIA of the eye. It usually lasts under 5 minutes, often under 60 seconds. And because it resolves completely, the most common response is, I think I need to see an optician. You don't need an optician. You need an ultrasound of your carotid arteries today. Symptom number 3, a sudden inability to find the right word. Not the normal tip of the tongue thing that happens to everyone. This is different. You know the word. You can see the object. You can describe it. But the word itself has vanished from your vocabulary for 10, 15, 20 seconds. You might say, hand me the thing you drink from, instead of cup. Your family might laugh. You might laugh. And then it's back and you move on. This is called transient aphasia. and it's caused by a momentary loss of blood flow to Broca's area or Wernicke's area, the two language processing centers in your left hemisphere. When I see a patient over 55 describing this, especially if it happened suddenly, lasted less than a minute, and resolved completely, that's a red flag, a serious one. Symptom number 4, and this one is the most commonly missed of all. Sudden, intense dizziness with no inner ear explanation. You stand up and the room tilts. Not spins, tilts. Like someone picked up one corner of the floor. It lasts maybe 5 seconds. You grab the counter. It passes. You think, low blood pressure, or dehydration, or standing up too fast. But vertebrobasilar insufficiency, reduced blood flow through the arteries at the back of your neck that feed the brainstem and cerebellum, can produce exactly this symptom. And because the brainstem controls balance, coordination, and consciousness, a TIA in this territory can mimic a dozen benign conditions. It's the great impersonator, and it's the one that most often gets written off. Now, you know what to watch for. But knowing isn't enough if you don't understand what to do with a real human being who's actually experiencing this. So let me tell you about someone. A few years ago, I'll keep this anonymous, but the details are real. A man I'll call David came into my practice. 61 years old, retired engineer, sharp mind, dry sense of humor, the kind of patient who comes in with a printed list of questions and times the appointment on his watch. Genuinely pleasant, but efficient. He did not like wasting time, his or mine. David came in because his wife made him. He didn't think anything was wrong. Here's what happened. 3 weeks earlier, he'd been in the garden pruning roses, and his right hand, his dominant hand, suddenly went stupid. His word, not mine. My hand went stupid for about 30 seconds, Doc. Couldn't grip the shears properly. Then it was fine. Honestly, I think I pinched a nerve. I asked him if it had happened since. He said no. I asked if anything else unusual had occurred. He thought about it. Then he said, well, about a week later, I was driving and the road sort of shifted. Just for a second. Like the car drifted, but it hadn't. I pulled over, sat for a minute. Felt completely normal. Got back on the road. Probably just needed lunch. 2 separate events, 2 different vascular territories. 3 weeks apart, both lasting under a minute, both completely resolved. I sent David for a carotid duplex ultrasound that afternoon. The result came back showing a 72% stenosis, 72% blockage, in his left internal carotid artery. A large, unstable plaque, the kind that sheds fragments. David had been having TIAs, plural, and every single one had been a warning that a major stroke was forming in the pipeline. He had a carotid endarterectomy, a procedure to clean out that plaque, within 10 days. And do you know what he said to me at his follow-up? If my wife hadn't dragged me in, I'd have kept pruning roses until one morning I didn't wake up right. He's probably not wrong. The reason I'm telling you David's story is not to scare you. It's to show you the gap. The gap between what a warning sign actually looks like and what we expect it to look like. David was expecting a heart attack, a dramatic event, a Hollywood collapse. What he got was a stupid hand and a wobbly road. And those were the most important medical events of his entire decade. Sound familiar? Even a little bit? Here's what I want you to do. Type in the comments right now. Has anything like this ever happened to you? A sudden, brief, unexplained moment where your body did something strange and then went back to normal. I'm not diagnosing you through a screen, I can't do that. But I want to know how common this experience is among the people watching this channel, because I suspect the number is much higher than any of us realize. And if enough of you share, I'll do a dedicated follow-up video breaking down the most common patterns. All right, now let's get into what you can actually do. Not after a stroke, but right now, today, to reduce your risk of ever having one. And I want to be clear, nothing I'm about to share is exotic. Nothing costs a fortune. Most of it is free. The problem isn't access to these tools. The problem is that nobody sits you down and explains why they work and exactly how to use them. So that's what we're doing. Method 1. The blood pressure audit. Here's a number that should be painted on every bathroom mirror in every house where someone over 50 lives. 115/75. That's the threshold below which stroke risk drops to its absolute minimum. Not 140/90, that's the number where your doctor starts frowning. I'm talking about optimal, and optimal is 115/75. Now, most people over 50 have no idea what their blood pressure actually is on a regular Tuesday morning at home. They know the number from their last checkup, which was probably measured in a stressful environment with a cuff that may not have been the right size, after they'd been sitting in a waiting room worrying about being late. That number is almost useless for daily risk assessment. Here's what I tell my patients. Buy a home blood pressure monitor, a basic digital arm cuff. They cost between $25 and $40. Not wrist monitors, arm cuff. Place it on your left arm, sit quietly for 5 minutes, feet flat on the floor, back supported, arm at heart level. Take 3 readings, 1 minute apart. Discard the first. Average the second and third. Do this every morning for 2 weeks. Write the numbers down in a notebook. Pen and paper, not an app you'll forget to open. After 2 weeks, you have a real picture. Not a snapshot, a landscape. If your average is consistently above 130/85, you need a conversation with your doctor. Not next quarter, this month. Because every 10-point rise in systolic blood pressure above 115 increases stroke risk by roughly 40%. 40. That's not a gentle slope, that's a cliff. Cost: $25 to $40 once. Time: 7 minutes a day for 14 days. Method 2. The ankle cross test. This one is free and takes about 3 minutes. It's a rough and ready home screening for peripheral arterial disease, which is, in plain English, the same plaque buildup that happens in your carotid arteries, but in the arteries of your legs. And here's why it matters for stroke. If you have significant plaque in your legs, you almost certainly have it in your neck and brain vessels too. The disease doesn't pick favorites. It's systemic. Here's the test. Lie flat on your back on the bed. Raise both legs to about a 45-degree angle and hold them there for 1 minute. Then sit up and let your legs dangle off the edge of the bed. Watch your feet. In a healthy person, both feet should return to a normal pinkish color within about 10 to 15 seconds. If one foot stays pale or turns a dusky bluish red for more than 30 seconds, that's a sign of compromised arterial flow. And that means you need a proper ankle brachial index test from your doctor. This is not a diagnostic tool, it's a screening nudge. But I've had patients catch serious vascular disease early because they did this in their bedroom on a Thursday night after watching a video like this one. Cost: $0. Equipment: a bed. Method 3. The 7-minute morning walk protocol. I could talk for an hour about exercise and stroke prevention, but I know that most of the people watching this are not going to start running 5 kilometers tomorrow. And that's fine, because here's what the data actually shows. The single most protective daily physical activity against stroke is not intense exercise. It's consistent, moderate daily movement, specifically walking, that maintains vascular flexibility and promotes something called endothelial function. Your endothelium is the inner lining of every blood vessel in your body. Think of it as a non-stick coating inside your pipes. When it's healthy, blood flows smoothly and clots don't form. When it's damaged by high blood pressure, high blood sugar, smoking, inactivity, it becomes sticky, clot-friendly, plaque-friendly. A brisk 7-minute walk within 30 minutes of waking up has been shown to improve endothelial function for the next 12 to 14 hours. 7 minutes. That's 1 lap around most residential blocks. You don't need a gym. You don't need special shoes. You need to walk out your front door, turn left, and keep going for 3.5 minutes. Then turn around. The key word is brisk, not strolling, not shuffling. Walking at a pace where you can talk, but you'd rather not. You should feel your heart rate rise slightly. If you're breathing a little harder by minute 3, you're in the right zone. Do this every single morning, rain or shine. It takes less time than making breakfast. and it reduces your stroke risk by approximately 20 to 25% on its own. Contraindication: if you have significant balance issues, joint pain that limits walking, or have been told by your doctor not to exercise, modify accordingly. A stationary bike at gentle resistance for 7 minutes achieves a similar vascular effect. Cost: free. Time: 7 minutes. Method 4. The hydration checkpoint. This one sounds almost insultingly simple, but hear me out because the physiology behind it is serious. Dehydration thickens your blood. Literally. When your body is low on fluid, plasma volume drops, and the concentration of red blood cells, platelets, and clotting factors increases. Your blood becomes more viscous, thicker, stickier, slower, and thicker blood is more likely to form clots. This is why strokes are statistically more common in the early morning, because you've just gone 6 to 8 hours without drinking anything, and your blood is at its thickest point of the entire day. Here's the protocol. Before you do anything else in the morning, before coffee, before breakfast, before checking your phone, drink a full glass of room temperature water. Not cold, room temperature. Cold water causes mild vasoconstriction, a temporary narrowing of blood vessels, which is the last thing you want first thing in the morning when your blood is already thick. Room temperature water, 8 to 10 ounces. First thing, every day. Then, throughout the day, aim for a minimum of 6 glasses total. Not 8. I know everyone says 8, but 6 is the clinically supported minimum for most adults over 50 who aren't exercising vigorously or living in hot climates. A simple test. Look at the color of your urine at midday. If it's darker than pale straw, if it's heading toward amber, you're underhydrated, and your blood is thicker than it should be. Cost? Essentially nothing. Time? About 15 seconds each morning. Method 5. The 60-second neck check. This one I want everyone over 50 to learn because it's something you can do right now, sitting where you are. Place 2 fingers, index and middle, gently on the side of your neck, just below the jawline, where you feel your pulse. That's your carotid artery. Now close your eyes and just listen to what your fingers are telling you. Is the pulse regular? Strong? Rhythmic? Good. Now here's the thing I want you to pay attention to. Does it ever feel like it skips? Like there's a missed beat, or an extra beat, or a brief flutter? That's called a cardiac arrhythmia, and the most common form in people over 50 is atrial fibrillation, AF. Your heart's upper chambers quiver instead of contracting cleanly, and when they do that, blood pools and forms tiny clots. Those clots travel, and one of their favorite destinations is the brain. Atrial fibrillation increases stroke risk by approximately 500%. 5 times. And here's the alarming part. Up to a third of people with AF don't know they have it because it can be intermittent. It comes and goes. Your EKG at the doctor's office might look perfectly normal because it wasn't happening during those 10 seconds of recording. If you feel any irregularity, any skipping, fluttering, or racing, even once, even briefly, write down when it happened, how long it lasted, and what you were doing. Bring that log to your doctor. You may need a 24-hour or even a 7-day cardiac monitor to catch it. This simple check costs nothing and takes 1 minute. It has caught undiagnosed AF in at least 4 of my patients over the years. 4 people who are now on appropriate anticoagulation therapy instead of unknowingly manufacturing clots. Method 6. The weekly cognitive baseline. This one is slightly unusual, but I think it's incredibly valuable. Once a week, pick a day, Sunday mornings work well, sit down and write a short paragraph by hand. 3 to 4 sentences about anything. What you did yesterday, what the weather is like, what you had for dinner. Use cursive if you can. Time yourself. You're not doing this to practice writing. You're doing this to establish your cognitive baseline, fine motor control, language retrieval, processing speed, spatial awareness. Handwriting engages all four simultaneously. If one week your handwriting is noticeably worse than the week before, letters are uneven, you can't stay on the line, a word just won't come, it takes twice as long, that's data. That's a signal. It may mean nothing, but it also may mean that something has changed in your cerebrovascular supply, and it's worth investigating. Keep a folder with your weekly paragraphs. Date each one. Over months, you'll see your own patterns, and if something shifts, you'll know it. Not because you felt a dramatic symptom, but because the evidence is right there in your own handwriting. Cost: a pen and paper. Time: 3 minutes a week. Let's organize this by weeks for those of you who want a structured start. Week 1. Foundation. Buy a blood pressure monitor. Begin daily morning readings. Start the morning water habit. 1 full glass, room temperature, before anything else. Do the ankle cross test once to establish your baseline. Begin your weekly handwriting check. Week 2. Movement activation. Add the 7-minute morning walk. Every day, non-negotiable. Continue blood pressure readings. After 14 days, calculate your average systolic and diastolic. Week 3. Vascular awareness. Learn the carotid pulse check. Practice it twice a week. Pay attention throughout the day to any of the 4 subtle symptoms we discussed: hand clumsiness, visual curtain, word-finding gaps, directional dizziness. If any of them occur even once, write it down immediately. Details: which side, how long, what you were doing. Week 4 and beyond. Consolidation. You now have a blood pressure landscape, a hydration habit, a daily walking routine, a weekly cognitive baseline, and vascular awareness skills that most people won't develop until they're sitting in a neurologist's office after something has already gone wrong. You are now ahead of roughly 90% of the population in stroke self-screening. Maintain it. It takes less than 15 minutes a day total. I've got a question for you, and I actually need you to answer it. In the comments, tell me your age and whether your blood pressure has ever been measured at home. Not at a doctor's office. At home, by you, with your own monitor. Just your age and yes or no. I'm asking because I'm working on a dedicated blood pressure series for this channel, and I need to understand what percentage of my viewers are actually tracking this number versus just hoping it's fine at their yearly checkup. That data shapes what I build next. So, age and home BP, yes or no. All right, let's pull this together. If you're going to screenshot one part of this video, make it this. Buy a digital arm cuff blood pressure monitor. Start daily readings tomorrow morning. Sit, relax 5 minutes, 3 readings, average the last 2. Do this for 14 consecutive days. Drink 1 full glass of room temperature water immediately upon waking, before coffee, before anything, every single day. Walk briskly for 7 minutes within 30 minutes of getting out of bed. 1 block out, 1 block back. Daily, non-negotiable. Do the ankle cross test once. Lie back, legs up 45 degrees for 60 seconds, then dangle and watch foot color. Note any asymmetry. Learn your carotid pulse. 2 fingers below the jaw, check for irregularity twice a week. Log any skipping or fluttering. Write 1 short paragraph by hand each week. Date it, keep it, compare it month over month. Watch for sudden changes in motor control or word retrieval. Crave. Know the 4 silent warnings. Sudden hand clumsiness on one side, visual curtain or graying in one eye, sudden word-finding failure, sudden directional dizziness or tilt. If any of these occur, even once, even for seconds, call your doctor that day, not next week. Red flags. When to go to the emergency room. Not your GP, not urgent care, the emergency room. Any of the classic FAST signs. Face drooping, arm weakness, speech difficulty, time to call emergency services. Any sudden, severe headache unlike anything you've experienced before. The worst headache of my life description. That could be a hemorrhagic stroke or a ruptured aneurysm, and it requires imaging immediately. Any TIA symptom, even the subtle ones we discussed, that lasts longer than 5 minutes. 5 minutes is the threshold. After 5 minutes, this is no longer a rehearsal. This may be the real event. Call emergency services. Double vision, sudden confusion, sudden difficulty walking, or sudden loss of balance with no obvious explanation. These are posterior circulation symptoms, and they are frequently misdiagnosed as inner ear problems, vertigo, or anxiety. They are not. Insist on imaging. One more, and this is one I've personally seen missed. Sudden, unexplained nausea and vomiting with dizziness, but no fever or stomach symptoms. In women especially, this can be a brainstem stroke presenting atypically. Do not accept a diagnosis of stomach bug if it came on suddenly with neurological symptoms. Everything I've walked you through today is designed to support your body's own warning systems and help you hear what it's already trying to tell you. None of it replaces clinical evaluation. If something doesn't feel right, even if you can't name it, even if it sounds silly, even if it went away, get it checked. The test that comes back normal is not a waste of time. It's a relief that costs you one afternoon. Here's the truth. Nobody at your doctor's office has 30 minutes to sit with you and walk through all of this. Not because they don't know it, most of them do, but the system isn't designed for education. It's designed for throughput, 10-minute appointments, code, bill, next patient. That's not a personal failing of your physician. That's a structural reality of modern healthcare. It generates revenue from treatment, not from prevention. The healthier you are, the less the system earns. That's not cynicism. That's accounting. And that's exactly why this channel exists. To close the gap between what medicine knows and what actually reaches you before something goes wrong. If this video made you think, even for a second, about a moment you experienced and dismissed, then it did its job. Subscribe if you haven't. Tap like because it genuinely helps the algorithm show this to more people who need it. And do me one more favor. Send this video to one specific person. You already know who. The one who brushes everything off. The one who says, I'm fine, and means, I don't want to think about it. Send it to them. Don't explain, just send the link. Let the first 30 seconds do the work. I'm Dr. Mark Tilden. I'll see you in the next one. Take care of yourself, because nobody else is going to do it for you.